Many people don't realise that pharmacists do much more than dispense prescriptions. They're highly trained healthcare professionals who provide expert advice, assess patients' suitability for treatments, and offer ongoing support for those taking medication. In the case of weight loss treatments, pharmacists play a crucial role in ensuring patients receive the right care, understand how their medication works, and are monitored for safety and effectiveness. Today, we'll explore how those medications work, who they're for, and the common myths surrounding them. We'll also discuss the pharmacist's role in helping patients navigate their options and get the right support, not just with the medication, but with long-term health and well-being. Let's get started. Fahmida, welcome to the podcast.
Thanks.
Today's topic is obviously weight loss medications. But what is that? Are there lots of different choices out there? What are they? Talk me through it.
So, there is a lot of different options. There's one that is a massive craze at the moment, which is Mounjaro. I'm pretty sure you've heard of it.
Yes.
Like everybody's heard of it. Mounjaro is not the only one. So there's fat absorption inhibitors as well. That's one that's called orlistat.
Yep.
But there's also GLP-1 inhibitors, and that is the Mounjaro, the Wegovy that everybody raves about.
I've heard of both of those, but obviously I've heard of the other one, orlistat, because I used to be training as a GP and it was something that we used to give at the time. But Mounjaro seems to be something that's come out a lot more recently.
Yes.
So how do they work differently? Why is one suddenly all the craze?
So with orlistat, it's just one that stops from any fat that's coming into your body from being absorbed. So you kind of it goes in and pretty much goes out. That's quite literally how it works.
Yeah.
Mounjaro and GLP-1 inhibitors in general, they actually work in a completely different way.
Okay.
So they act on different parts of your body. They act on the appetite section of your brain, work on suppressing your appetite, but they also work on hormone regulation. If you've got any insulin resistance in your body, it helps also kind of burn fat and energy a lot quicker as well. So there's actually so many ways that it works in your system, and it benefits you in so many different ways as well.
So why isn't everyone on this type of medication then? It sounds amazing.
It is definitely amazing, definitely life-changing, but it's not obviously for everybody.
Yeah.
It is more for people who have obesity. So obesity is an epidemic in itself. It's more directed for people who have weight that they're struggling to lose. So if you've got a BMI over 30, or if you've got a BMI over 27 and you've got any other kind of health condition, such as any heart conditions, or if you're diabetic, you benefit more from this medication than anybody else.
Talk me through how people who would fall into those categories of either having a BMI of over 30 or having a BMI of over 27 with other comorbidities, how would people who therefore feel like this could be something that could be helpful for me to lose that medication, to help with my comorbidities as well, how do they find this medication safely? Because it seems to be everywhere, but also you hear horror stories.
Oh, there is a lot of horror stories, I think, because it is so well known and a lot of people are talking about it, a lot of people want it, they try to access it wherever possible. Yeah. But I need to stress, more than anything, you always need to make sure that you're getting it from someone who is a GPHC registered pharmacist who has training in weight loss, in Mounjaro, in orlistat, and all of those weight loss medications. GMC registered doctor. So you need to, I would advise doing all the research you can into whatever provider that you're getting it from, be it a GP or be it an online pharmacy. Just make sure they are GPHC registered or a GMC registered.
To me though, because there seems to be so much access to this, some people are getting it from people who aren't registered pharmacists and trained doctors and so forth. Where do you think people are getting some of these medications?
If they're not able to get it through a registered premises, then they can be getting counterfeit medicines, and they might not have exactly they might not have Mounjaro in them. Yeah. They might not have the GLP-1 agonist in it. They might be laced with other drugs. Yeah. So it is. You need to be very careful from where you're getting it from. It's the same with any medication. If you don't buy it from a legit source, then you technically don't really know what is in them.
But I think it's so important to delve into that, because people might just look at a price tag or think, well, why, if we're getting it from a pharmacist or a doctor, they're just putting the price up for no reason. But there's so much more that goes into the manufacture process of a prescribed medication. It's obviously the training for the person doing the prescription, but it's also the route route that medication has gone down before it gets into you, what's in that medication, whether it's safe, whether it's out of date, whether it's been stored correctly. Is there anything I've missed from that?
You've hit all of them. You've got all of them.
And, people are injecting this essentially into themselves. And we've heard some horror stories of some people having things like insulin in the medication instead of the GLP-1, and it can be extremely dangerous.
Yes, absolutely.
So absolutely vital to get it from a reliable source.
Yes.
How would you advise patients or people interested, maybe even people who don't know what their BMI is or whether they're a candidate, what route would they go down to find someone reliable? What things are they looking for?
So, like I said, make sure you're finding a GPHC registered pharmacist or a GMC registered doctor. There's a couple of ways you can do it. So if you do want to go through a doctor route, speak to the doctor directly. You can discuss. We will ask all questions. So the kind of things that we discuss during a consultation, we'll always ask height, weight, general health conditions, if they're taking any medicines, any over-the-counter medicines, any herbal products. We ask pretty much everything. If you're pregnant, breastfeeding, anything that can impact your weight in general, we ask about. And we also ask people what their lifestyle is like.
Good.
We'll ask how their diet is, if they do exercise, all that kind of stuff. So when you are speaking to a pharmacist or a doctor, we are checking in on a monthly basis.
Okay, so regular follow-ups as well.
Yes.
With when it's a good provider, they should be providing regular follow-ups as well. Okay.
You should always have regular follow-ups, just because it's still a medication. You will be having side effects to it. If you're having anything that any side effects that you're struggling with, you can always discuss it with us, and we will try to support you in any way that we can.
Monitoring is also really important for ensuring success.
Yes, absolutely.
In the medication and maintaining results that you have long term. So you need that support throughout the whole thing.
Oh, absolutely, yeah.
Okay.
I think a lot of people look at Mounjaro like it is like a magic drug. Yeah. While it is an amazing drug, you have to make a lot of lifestyle changes alongside with it. It's not just a quick fix. Yep. It is an overall journey to your own health, to maintaining your own health and well-being. So you have to make changes to your diet, you have to make changes to your lifestyle, you need to do the exercise, and everything works hand in hand, and you need to make those lifestyle changes to be able to maintain that weight afterwards. Yep. Just because you don't want to become dependent on the medication either. Yep.
So I always think of it as a tool, and you do the work, and to go into it with the mindset of how you want to potentially come off it if you decide not to have maintenance with this medication. So if you want to be someone, when you get to your goal weight, to have a healthy lifestyle, to be exercising, go into this journey doing those things already, and that's going to give you a much more success story. So tell me more about how people can go into this. If they decide, if let's say they've hit the criteria, they found someone reliable, and they're getting monitored, and they start their journey with something like Mounjaro, GLP-1 agonist. What type advice would you give to people on that journey to really make a good success out of it?
So the first and main one that I actually always give is please make sure you drink plenty of water. Okay. So like with any medicine and all the side effects you can have things like you get a headache, and you can have a bit of nausea, you can have like a bit of a GI upset kind of thing. Always say drink plenty of water, drink more than what you normally would. The normal advice is 2 liters a day. I would actually recommend drinking more. Okay. So that is one of them. The other one I would talk about is the exercise, the lifestyle habit. So a lot of people who are starting the GLP-1 medicines, you see a lot on the consultation forms that they don't do any exercise at all. So it's building yourself up. I would always recommend, even if you just start going for a walk, even if it's a 10-minute walk a day, build it up. Go for 15 minutes the next day. Go for 20 minutes after, whatever you can build yourself up to.
Because when you come off it, you want to be already into that exercise. So fantastic. What else?
There's a bit of a myth where people think, oh my gosh, I'm going to get addicted. It's not an addictive medication. It doesn't work in the centers of the brain. Yes, that kind of keep you addicted. Yes. Yeah. Okay. It doesn't work in that at all. So
you don't crave it.
No, you definitely don't crave it or anything like that. It's just more. I think a lot of people it's like a placebo. A lot of people become dependent on these medications. When actually, if you've got the right support, if you're checking in with someone every month, you can work on your own lifestyle changes, and you essentially then don't become dependent on it. So it's a lot about mindset than anything.
I think it's like any diet, that lots of diets will work to lose the weight, but you only keep the weight off if you create the framework around your life to be able to maintain that weight afterwards. So we talked about lots of water, starting some exercise and getting healthy habits. Any other tips that you would give to people who decide to start this journey? Because it's, as we said, it's one tool. We want to gather as many other tools as possible to have a success story. What other tips would you give to people?
I would say to people all the time to fix their diet. With the diet, it's making sure you are staying off any fatty foods, anything that are, takeaways, high in fat, that kind of thing. We all love a takeaway. I love one myself. But it's trying to minimize it. So instead of, having them every single night, which some people can do, once a week, once every 2 weeks, treat yourself whenever you can. Have a cheat day here and there kind of thing.
Balance.
Yeah, it's all about balance. You can still have and do the things that you enjoy and that you like, but try to do it in a balanced manner. So I'd always say that. I'd always say try to increase your protein intake.
That's what I've heard as well.
Very, very important. Just because you are losing that fat very fast, you want to try to turn that fat into muscle if you can. So high protein intake. Really,
and you want to maintain
important.
the muscle that you have as well, don't you? Because when you lose weight quickly, it's not just fat that you can lose. You can lose muscle, and that's quite important. It's especially important for women, isn't it?
Oh yeah, absolutely. It's especially important for women. With women, especially if you are a little bit older, you're starting to go through menopause. If you've got PCOS, you actually store fat a lot more than what a normal person would. And that fat tends to stay in the abdominal area. And it's very, very difficult to get rid of. You need to make sure you're having the right proteins, and that fat will burn in itself. So when you are, say, menopausal or you've got PCOS, you've got low levels of estrogen in your body. So with the GLP-1, so say if you're menopausal or if you've got PCOS, the chances of you having insulin resistance is a lot higher. You can have insulin resistance even without being menopausal or being having PCOS or anything like that. You can just be a general person who has insulin resistance,
which makes weight loss harder, doesn't it?
Oh, it makes it so much harder. When the insulin in your body, that burns all the fat, it helps regulate your blood sugar, and if you're not able to do that, it doesn't matter how much you exercise, it doesn't matter how much you change your diet. Sometimes you can't lose that excess weight that you are trying so hard to lose. So this gives it that boost. So what it does, it regulates the insulin in your body, and it increases your insulin sensitivity.
And actually, I've heard that people can actually find that their symptoms of the PCOS can improve. Is that correct?
Yeah. So when you've got PCOS, you've actually got higher androgen levels in your body, and that can give you things like facial hair, all those kind of symptoms. And what the GLP-1 does, it actually reduces the levels of androgen in your body. So it's actually been clinically proven to help with people with PCOS and relieve symptoms of, say, facial hair or...
so other benefits alongside the weight loss in certain comorbidities. That's incredible. So someone's started their journey and they're doing all the healthy habits, the higher protein, the lots and lots of water, having balance with their healthy lifestyle, getting some exercise. You also talked about mindset's really important part of that journey. What sort of things would you give advice to people?
So when it comes to mindset, I think it's always good to remember to be kind to yourself. You need to remember that everybody is on their own journey. Everybody progresses differently. Everybody loses weight in different timelines, different time frames, and in different ways. They lose it from different areas of their body. You just always have to remember to be kind to yourself.
So don't compare. Be on your own journey. Go into this with the mindset of what the lifestyle and the person you want to be when you are at your maintenance. I love that. I love that. But you get support with all of that mindset, with how to do the lifestyle changes, because if you've gone through the right path, you've got a medical professional, you've got a pharmacist who's helping you out. So tell me a bit, firstly, about your background as a pharmacist. Tell me a bit about that, and then we're going to talk about the support that you can get on this journey as well. Okay.
So I'm a prescribing pharmacist. I am trained in Mounjaro. Started off as a pharmacist, I think maybe about 7 or 8 years ago, and then did my prescribing course not long after. So ever since then, as soon as kind of the GLP-1s and all the weight loss medications have come out, I've done kind of all this thorough training in Mounjaro, in weight loss in general, in nutrition, everything like that as well.
That's fascinating to me because I've met medical professionals who prescribe this, but they're like a jack of all trades.
Yes.
You've really honed over the last few years into doing this, and this is your thing.
So I think that's the difference maybe with a prescribing pharmacist and a GP. A GP obviously has so much knowledge on absolutely everything, but we specialise in specific areas, and we train on those specific areas such as weight loss, and other areas that we can then help. And the Mounjaro is a very new drug, so it's obviously only been prescribed for the last year and a half or so. So we've been monitoring patients, we've been seeing kind of trends as to what people are asking, what they are needing support with, and we then continue to train on those aspects to be able to give the patients the support that they need.
That's incredible. I did not know that you can be so specialised, and then therefore obviously you can monitor really how this evolving journey with GLP-1 agonists is coming through into the world. That's incredible. Well, we've got lots of questions at the end that we're going to really grill you because you'll know those about those. But let's all go back to this patient. Let's say someone who's going on this journey. What's a consultation like with a company like Cloud Pharmacy who is specialised in this? What does a patient go through?
So there's 2 different ways to do it. At Cloud Pharmacy, if you don't want to actually speak to somebody face-to-face, we have a consultation, which is very thorough. It asks all the questions we require. It requires you to upload a picture just to kind of show that you are eligible. We ask for images that are where you're wearing tight-fit clothing just to ensure that obviously you fit the criteria. And we then ask about height, weight, your general health conditions, if you're taking any medicines, be that over the counter. We ask about calorie intake. We ask about, we ask
lifestyle as well, don't exercise.
Lifestyle, exercise, alcohol intake. If you smoke, we ask everything.
And I presume that's so that it's not just to prescribe the medication, it's so you can give that really holistic advice to help that person, support that person throughout. Is that right?
Yeah, that's it. And every month when we then check in those questions, we also ask, have you had any side effects, any changes to your body, any changes in medication? We do a monthly check-in just because things can change month to month. When you are in that obese range, sometimes you have medical conditions that you're not even aware of. So it also kind of brings them to light sometimes as well when you start to lose that weight. And we are able to kind of monitor the progress and see how patients are getting on, see if there is kind of anything else that we can then help them with. And support in that aspect as well. And
I presume being a pharmacist as well, you'll be so aptly placed to also, because if they've got other medical conditions, they'll be on other medications. So the interaction between those and everything else, you're just like the perfect person to make sure that if they're adding in this new medication into their life, that it's going to be done safely. It's not going to cause any issues. And it's really reassuring to see that every month you're also touching base and also helping with them, not just with the medical side, but with the holistic, ensuring you give them appropriate advice as well. So that's incredible. Do you also offer any support after someone's received some maintenance? Because obviously medications like this, you change the dose. So am I right that patients often increase the dose slowly until they get to a dose that they're happy with? Then they're on that for a period of time until they will get to their maintenance weight. And then there's a discussion about whether they're slowly weaning off or keeping on some sort of maintenance dose. I presume that's all part of the process with yourself as a pharmacist. What happens, let's say someone wants to finish everything, what advice and what help do you give that person at that point?
So we will support maintenance for however long, lifelong if we need to. We speak to the patient, see how they're getting on. At Cloud Pharmacy, we take patients on right up until a BMI of 19, and we keep them at as patients up to a BMI of 19. So we can support you right up until then.
Wow.
We will kind of lower the dose. So patients can start off at 2.5. They can go up to then 5, 7.5, and the highest dose is then 15 milligrams.
Okay.
You don't have to go up to 15 milligrams.
That's good to know.
I think it's important for patients to be aware that you don't need to jump up dose every month. If you found a dose that works with you, stick at it for as long as you can, and then kind of build yourself up, whatever works for the patient. We look at all that, we build the dose up, and then as the BMI is slowly coming down, when it gets to a BMI of, say, 21, at that point we start discussing maintenance with the patient.
Yeah.
And we say to them,
Because you don't want it to drop much lower than that, do you?
No, we don't want. You don't want to get to an unhealthy BMI, which is anything under 19. So we support right up until 19, but we also want to keep it at 21 because I think that's a good, healthy BMI. And we will then start to reduce the dose. So we will say, okay, we'll keep you on a dose that you feel like you're not losing any more weight, but also that food noise that you're feeling, any maintenance that is supported through that dose that we then put you on. That could be 2.5 milligram, that can be 5 milligram, that can be 7.5 milligram.
So it's really bespoke for everyone.
It's very bespoke. As long as you are no longer losing weight, but you're still kind of feeling the appetite suppression that you feel like you need support with, we will
support you with that.
We'll support you with that. And then say if a patient wants to then come off it, we will make sure that the patient is at a point where, okay, they have made the lifestyle changes that they need to, they're doing the more exercise, we'll discuss any difference in diet that they have done, and if they feel ready, then we'll absolutely fully support them to come off of it. Patients can also then come back on if you've had it before. So if you've had it at Cloud Pharmacy, and we've got, a history of all the medications that people have had. So we will see that they've been on it, and we will quite happily put you back on, even if you're...
That's good to know. I think some people might be worried that if they decide to stop, how do you have to start the whole process again? But if you're someone who's known to you, you can... So it really is bespoke.
Yes, so bespoke. You can jump back on at any time if you feel like that you need that support again. So I think it's important for patients to know that it's not that, you're going to get to a BMI of 21 and you're no longer eligible. You've been on the medication for so long. You can always jump off, see if you've been able to maintain that lifestyle. And if you can't, come back, get a little bit more support wherever you need.
That's good, because some people do worry that they might never, ever be able to come off it. So what do you say to patients who have that fear?
With those patients who have that fear, I just try to remind them that it's not a medication that alters your brain chemistry. It's one that supports you. It is a stepping stone in changes in your life. It's not something you need to be dependent on. As long as you have made those changes in your habits and your lifestyle, you will be absolutely fine.
But I think research also shows that obesity is complex. It's got lots of other influences, whether that be hormonal, mindset, genetic, environmental, mental health, all these different aspects. And it's just one of those little tools that can help alongside it in a really complex playing field. And so, yes, if someone needs that tool to help them and maintain a healthy weight, and therefore they have less other comorbidities, their lifestyle's improved, they have more confidence, all these other things, then that's a great thing. But as you said, it's not addictive. People don't crave it, but they might need that extra tool for a longer period to stay in that healthy range. But that doesn't mean it's addictive.
That doesn't mean it's addictive.
Absolutely.
No. And we're always here and happy to support that. If that is what a specific patient needs. I'm not opposed to that. There's a lot of people who need more support than others, and that's absolutely okay.
But just like any other medication for other comorbidities, sometimes we need to be on these long term because there's a complex interplay that's going on in our bodies, and this is just helping our bodies with that. So I totally get that. So how much weight can patients lose on weight loss medications?
So if you look at it clinically, patients can lose up to 10 to 15% of their body weight within the space of a year.
Wow.
However, I have seen in my own patients a lot more than that. I have had a patient who was a size 18 who suffered with PCOS, who suffered with a few other comorbidities, and they went down to a size 10 within the space of 8 months.
Wow.
And they have never felt better in their life. So they they continuously talk to me about the lifestyle changes they have made, the habits that have changed, and the fact that they just feel better within themselves.
Yeah, I bet they must go out into the world as a totally different person.
Absolutely.
And just the confidence that must give. And obviously some people might think, wow, that's a lot. The key is that you were there throughout that journey to make sure she did it safely.
Absolutely.
Throughout.
Which is why it is so important to make sure you're going to someone who is registered and trained in weight loss.
Yeah.
With that, we were then able to support her, make sure she wasn't having side effects in those 8 months.
Yeah.
And made sure that, any concerns she had, they were addressed. There's a lot of scaremongering when it comes to weight loss medications. A lot of making sure that you're taking the correct dose. So say if you're titrating up, you're on 2.5 milligrams, you can't just jump to 7.5. The amount of patients I see who are like, I'm fine on 2.5, I'm just going to take, can I have a 7.5, can I have a 10?
What would happen if they did that?
Oh my God, the significant side effects is really dangerous. It's like any medication. You can be on, say for example, a blood pressure medication. Take 5 milligrams of something, for example, works fine in the body. Take 10 milligrams,
you'll fall over.
You
fall over from your blood pressure suddenly dropping too far.
Yes.
It's working like too quickly. Yes.
So you need to make sure your body becomes accustomed to the medication the same way you would with any other prescription medication.
So tell me, is it safe then?
Yeah. So
what are the side effects that you could get?
So like all medicines, there's obviously risks, there's side effects, but they are safe if taken properly.
Keywords, if taken properly.
If taken properly. If taken properly. With the weight loss medications, first initial side effects that you will always have, and not always, that you will be likely to have are nausea. Sometimes you can have a little bit of diarrhea, or constipation, can work either way. You can get headaches as well. So those are the possibly the most common side effects.
And by starting with a low dose and slowly working your way up with the support of a specialist, are those more manageable?
Yes.
Yeah.
Yes. So say at Cloud Pharmacy, if someone is experiencing high volumes of nausea, then we can prescribe them other medications that help with that as well. But with that, they're obviously checking in with us, making sure that they have had that nausea for a little while and it's something that's not going away. We're able to then support that as well.
Okay, so other side, so we talked about the common side effects. We often hear a lot in social media, in the news, of other quite sensational side effects. And I want to ask how common these actually are. So for example, we hear a lot of pancreatitis and the dangers associated with these medications, like pancreatitis. How common is that?
So it's not extremely common. It's one of the rarer side effects, but it is definitely a side effect of it. Okay. It's why it is so important for during any consultation to disclose if you have had any pancreas problems before, if you had say for example gallstones, or any gallbladder issues, or if you are taking the medication and you're suffering any stomach pain, if you've got any differences in your body, you have to always disclose that, just because that side effect is there. And it is a possible side effect, and we want to be able to support that in the best way that we can. Sometimes, for example, people are getting that abdominal discomfort and then they think, oh, it's nothing, it's just a side effect, I'm just going to increase my dose. But if you increase your dose at that point, then you're increasing the side effects, or you're increasing the chances of getting pancreatitis. And
I think we've got to remember that patients who are using this often have comorbidities, have a diet that maybe hasn't been the best, and so even that's why it's even more important to get the support other than medication, like how to eat well. Because if you're only eating a slice of pizza because that's all you're hungry for, but the only food you're having that day is a slice of pizza, you're more likely to get the negative side effects. So you're much safer doing this, being on medication like this, and having therefore a lower risk of these more scary side effects when you're doing it with that support and following the advice.
Yeah, that's it. Well, the other thing is that, say for example, if you are in that obese category, you might like we just discussed, you might have certain medical conditions that you're not even aware of. I have one actual really good example of this. I had a patient who started on Mounjaro, and as they lost weight, they actually discovered a lump that had actually been there for a significant amount of time.
Okay.
And it was in their breast. But as they lost weight,
they were able to feel it.
They were able to feel it. They were able to see it.
But the fear would be, oh, is it caused by this? Is it not?
It's
and that's
absolutely
why
not caused by. It was actually something that allowed them to actually discover. Oh, I've got this medical condition. I need the support. Felt really. It's obviously such a heartbreaking story for the patient, but it changed their life. And being able to actually get the support they need.
And the newspapers would say, oh, it caused it or this, but you've got to have the whole picture and have someone who actually medical assess the situation. Other people have said things like it can cause hair loss.
So hair loss isn't actually caused by the medication.
Okay.
It's actually caused by, so when you're losing weight, you're losing fat at quite a significant rate as opposed to what you normally would. Mm-hmm. So while you're losing fat, your body's going through those general changes it normally would when you are losing weight, but it's doing it at a faster pace. When your hair is falling out, your hair sheds in general, but it's just shedding faster because your body's changing a lot faster.
So it's just a natural process of weight loss, not of the medication. Another side effect I've heard recently about GLP-1 agonists is that they can cause vision problems.
With vision problems, they're not very common at all. With patients who have diabetes, they have something called diabetic retinopathy. And diabetic retinopathy in general can cause vision loss. And it tends to be those patients that do have diabetes that obviously feel probably the loss in vision and that kind of thing. I'm not saying obviously there hasn't been other side effects of it.
It's a bit like that story of the woman who lost weight and therefore found the lump. Something that was there all along. But you might become more aware of how your body's feeling because of different medications. So it might highlight something that's underlyingly there already. Okay. Well, last question I've got for you is, what about patients who are pregnant or breastfeeding? Are they ever candidates for medication like this?
No. I would never, to be honest, as a pharmacist, you don't really recommend any medications who are patients that are pregnant or breastfeeding. Just because there can be certain things that are harmful to your baby and you don't even realise it yet. And you also don't want to take that risk when it comes to being pregnant or breastfeeding. So I would never ever recommend it to anybody that is pregnant or breastfeeding.
And just because I've realised we've not really covered this, but it might be someone who's thinking about it, they might be going, but what is it actually like taking this medication? So we've talked about the consultation, we've talked about potential side effects like nausea and so forth. But what's it like? Because it's an injection, isn't it? Once a week. And then what actually happens? Are they just feeling less hungry? Less food noise.
That's it,
maybe a bit nauseous, but otherwise they're able to live their life, do everything normal, socialise. They don't have to have a special diet or a liquid diet or anything like that. Is that right?
That is absolutely correct. It is. The way it works, it is an appetite suppressant. It works on regulating the hormones in your body. And it works on helping you burn your fat a lot quicker than what it normally would.
We're going through the science facts of it, and but what someone wants to be like, but what is it actually like if I do this? Is it scary to take? Do you help people through the process because it's an injection? Do you help them with how to do that? Do some of them have a lot of fear? Because you talked about some of the consultations are done through forms. How do you help them with the needle side of things?
So we send every patient, as soon as they've signed up to Mounjaro, we send them a guide as to how to inject, where to inject, where they feel there's different areas that you can inject into. So that's your arm, that's your stomach, that's your thighs. Best places to inject into. Very, very, very small needle. It is absolutely tiny. You pretty much can't feel it. And you can just inject once a week and go on your life as normal. So it is, it's life-changing, honestly. And the only thing you feel is that sometimes, when you're kind of sitting and you're doing your work or you've got nothing else to do, you just think, let me just go grab a bar of chocolate. Let me go grab a biscuit. That food noise that is there. And I have that every day, all the time. Comes the chocolate, I'm like, send it my way.
Certain time of day is my chocolate o'clock.
But if you're on that Mounjaro, you'll actually not feel that as much. That's what's called food noise. You'll just be like, let me continue with what else I'm doing. You'll find something else to do, but you won't think to yourself, let me go back, grab a bar of chocolate.
And then once that thought's in your head, when you have the food noise, you just can't do anything else until you get your jar of chocolate. So no, this will help reduce that. Okay, brilliant. Let's also talk about the fact that there is stigma. What do you say to people who judge people wanting this medication, who just have this attitude when maybe their friends are on this medication? Talk about the stigma around it.
So I would say when it comes to the stigma around it and judging people, I think what a lot of people don't realise is that obesity is an epidemic and a medical condition in itself. And until you are suffering from it or experiencing it yourself, you can't really put yourself in that other person's shoes. You don't know what they're dealing with. You don't know how much they've tried to lose weight in different ways. You don't know what diets they've been through. You don't know how much exercise they've done to get rid of that weight. A lot of people will turn around and be like, oh, just go to the gym. Oh, just change your diet. But it's not as simple as that for some people. Yeah. Some people it's genetic. It's hormone change. It's hormone imbalances. Yep. And they need that extra support to be able to shift the weight that they've not been able to budge for X amount of time. And it's working, and people are getting healthier. People are finding it life-changing as a result. So, and I think I'm hopeful that the stigma is starting to shift, because it's been around long enough that people are seeing the positive outcomes out of it, more than the fear-mongering that was around before. With the fear-mongering, it's the few sensitive cases that you do see, and obviously, people do have certain reactions, side effects to it. Everybody's body is different. Yeah. That is not to say every single person who is taking it is going to have these side effects. Is going to end up in the same position as somebody else. Yeah. You don't know that. And the key is people are going into it because they're realizing that they need to go to the reliable places to access it, and those reliable places are also giving that support. So they're going into it as a tool, along with lifestyle changes, mindset. They're getting that regular support, and therefore they're having less of those side effects. They're having the success stories, and it's fantastic. If you could clear up one major misconception about weight loss medication, what would it be? I would say the most common misconception is that it is for lazy people. Mm-hmm. I think what people need to realise that it's just part of a puzzle. It's part of a broader goal in achieving lasting health. And I think people need to remember that. It's not just for lazy people. You are making the changes in your life whilst you're taking these medications. Yeah. It's a motivational support. Yeah. And a lot of people need that more than you think. Yeah. You don't know what's going on in someone's body. You don't know how hard they've tried. And it's just so important to remember that when you see anybody or you're taking these medications yourself. And I think people need to go into it with that mindset as well, saying it's not the easy way out as well, and go into it with that mindset of maintenance. It's just that little, as you called it, a piece of the puzzle to the whole journey to getting to the maintenance weight and then maintaining that weight as well. Yeah. I love that. Any final words of advice or encouragement for anyone who's been listening to this and thinking this might be for them? I would always say to people, make sure any information you're getting, there is a lot of information out there. There's TikTok, there's Google, everything. Just make sure you're getting your information from a reliable source. And if you are wanting to start the medication and if you are eligible, please seek help from an expert before you do so. And I think that's the most important thing. But we really want to encourage everyone listening to this, that if this is something you want to go down the route of, it's so important to seek that medical experts to help you with that journey so that you are doing it safely. Absolutely. But also having that extra support, that monitoring throughout, so that you have a success story out of it as well. And that's the main thing. You want to feel successful in your own journey. Love it. We hope you've enjoyed this conversation and learnt something new, and maybe we've even busted some preconceived ideas of yours around weight loss medication. Next week, we're going to be joined by a lovely patient, Marianne, who's going to be sharing her journey and her story on Mounjaro. Have you heard something on the podcast that made you think, I need to ask a doctor about that? Well, good news, you can. With onlinedoctor.co.uk, you can book a same-day virtual appointment with a fully qualified doctor and get expert medical advice from the comfort of your own home. No waiting list, no hassle, just quality healthcare tailored to you. Book now and take control of your health.